So this is the first episode of the Family Health with Dr. Lex podcast and YouTube channel that I'm doing by myself. I've historically interviewed physician colleagues and experts in their fields on different topics, ranging from specific disease conditions to wellness, stress management, life transitions, finances. We've discussed a whole wide variety of topics, but today, my intended audience is anyone who wants to be a physician. So you think you want to be a doctor? You want to go to med school? This episode is for you. It's for the elementary school kid who was afraid to go to the doctor and met the kind, gentle, loving doctor who they looked up to and saw as a hero and said, I want to be just like her. It's for the young teenager who has no relatives who have even gone to college, but thinks to themselves, I really want to be in medicine. I really want to start that journey and enter into that career. It's for the mid-career engineer who's thinking, I have these great skills and I want to use them to do something different with my life and make a career change. And of course, it's for the young college student who knows and has known forever that they want to be a doctor and just need a little bit of guidance as to how it all works and what is the best way to get there. So you want to be a doctor. I'm so excited to talk with you. My name is Dr. Alexis Hugelmeyer. I am a board certified family physician, originally from the Jersey Shore. I took a pretty traditional route to medical school. I didn't always know that I wanted to be a doctor. My dad is a pulmonologist and intensive care doctor, critical care doctor. So I knew from an early age that he dealt with life and death. And I saw him go to work and work very hard every other night, every other weekend. He was on call. And while I knew that his work was very important and he was such an inspiration to me because of how smart and compassionate and empathetic he was, I didn't really think about going into medical school until I was in college. In fact, I actually started college as an education major. I thought I wanted to go into education. I wasn't really sure. And I met my mentor in college, my career advisor, Dr. John Freedy, and I took a couple of courses with a couple of other kids who all knew from a very young age that they wanted to be doctors. And so I set out on a pre-med program where I would have all the prerequisites that I needed to apply to medical school. But even at that time, I still didn't really know. I still wasn't really certain that I wanted to be a physician. I didn't know if I wanted to commit my 20s to education, medical school, residency training, fellowship. I wasn't sure that that was the life that I wanted to live. So I started to volunteer. I volunteered at Children's Hospital, Philadelphia. I did some volunteer work in the University of Pennsylvania OBGYN clinic and on the labor and delivery ward, where I got to see doctors delivering babies, and I was hooked. I was sold. I said, this is for me. I absolutely need to be in this profession. I thought for sure I wanted to be an obstetrician gynecologist. I wanted to help bring life into the world. In fact, when I first decided that I wanted to be a physician, I thought that I wanted to be an infertility specialist. I thought that I wanted to help women who wanted to have children, but were having difficulty getting pregnant. I thought that that was what I wanted to do. And so I did all my prerequisites. I got the best grades that I could. I shadowed for many years during college. I did research. I came home on summer breaks and I worked in my dad's office and I spoke with his colleagues and learned as much as I could. I went with him all over his hospital. I went into the radiology suite and I went into the ER and I went into the OR, and I was able to kind of get a glimpse, really, for the first time in my life as a college student, of what it means to be a doctor, what that looks like. I knew what the lifestyle was like. I knew what my dad did, but I didn't really ever get to see the inner workings of a hospital. And I think that's a really important point. If you're considering a career in medicine, you really need to know what you're in for and what you're going to get into. If this is something that you can see yourself doing, then by all means proceed with the course, because it is a long road. It is a difficult journey. And if you don't love it and are not absolutely passionate about it, it can be even more difficult to complete. So we always say that medicine is a calling. It's not a career. It is something that you feel from your heart, from your guts, that you are called to do. And if you get some exposure to medicine, whether that's in an office or a hospital or an operating room, you get to shadow someone and you can identify that this is something that you can see yourself doing, you feel called to it, you feel pulled to it, you feel like it's something that you need to do, then definitely go for it. There are a million people who are going to tell you, go to law school, do something else, be a pharmacist, be a teacher, do not go into medicine. And that happens for a number of reasons. There are plenty of people in medicine, as there are in every field, that are burned out and that are not happy with their career choice. So there's a lot of people that you will hear tell you to do something different. I am here to tell you that there is no other path that I would have chosen, that this career has given me probably some of the most rewarding relationships and interactions and experiences of my entire life. And that every day that I get to take care of patients continues to be an honor and a privilege that was worth the sacrifice and the hard work that I had to do to get here, which included getting the best grades that I could in college, applying to medical school, taking all the MCATs and the pre-med prep courses, getting a good score on my MCATs, applying to and getting accepted to medical school, which is kind of the hardest part, spending 4 years in undergrad, getting into med school, spending 4 years in med school, choosing a specialty, which I'll explain in a second, going into residency, which can last anywhere from 2 years to 10 years. And then after that, deciding if you want to specialize and go on and do a fellowship. So let's start in the beginning. Getting into a great college is a great place to start. Doing well in high school, getting great grades, being very active, doing community service, engaging in leadership activities or research. These are all great ways to bolster your application to college, to get into a really good college. And the better college you get into, the higher degree of difficulty your education, the more rigorous the curriculum, also the more connections you make and the better opportunities that you have. So you want to go to a really good school. That said, physicians come from all backgrounds. I know I have physician friends who started in community college. I have physician friends who went all the way through and had a career as a nurse or a teacher and then decided to change after the fact. So people come to this field from all walks of life, from all backgrounds. I know people who went to prep school, went to the fanciest, most expensive prep school. And I know kids who had, pretty shoddy public schools education. I know kids who are come from very wealthy backgrounds, come from middle class, and kids who were impoverished, who were living in foster care, who came up through the system and became physicians. So no matter what your situation is, if it's something that you want to do, you can do it for sure. Getting good grades in high school, being active, being involved, shadowing doctors or teachers. The word doctor comes from the Latin verb docere, which means to teach. We want to teach. We love to share, and it's part of our oath. We take an oath to do no harm, do the best that we can to help as many people as we can. And also we pledge our lives and commit ourselves to teaching others how to do what we do. It's part of our oath as physicians when you graduate med school. It's called the Hippocratic Oath. So you do your best in high school, you get the best grades you can, and you get into college, whether that's community college, you get into the best college you can get into, and you take a pretty rigorous course load in college. There are certain prerequisites. You need to have a certain amount of math credits, a certain amount of biology, chemistry, physics, and there are some other requirements, but those are the main pre-med requirements. And you should, once you're in college, meet with and develop a relationship with a pre-med advisor. And that is a person who will help you make sure that your college transcript sets you up to be prepared for medical school applications. Because if you don't have those prerequisites, you can't even really apply. And the same is true for someone who's in midlife, who's in their, who has maybe started another career, or someone who is, already in a graduate degree program and wants to go back to medical school. You'll need to make sure that you have those prerequisites in place in order to even apply to medical school. In addition to your college transcript, which needs to be pretty glowing, needs to be pretty impressive academically, you have to take what's called the MCAT, which is the medical college admission test. And it's a pretty standard, a test of standard knowledge in math and reading and sciences. And you're scored on that test, kind of similar to the SATs or the ACTs, and you get a score. And then that score for that test is part of your application. to medical school. So medical school then will take a look at everything that you've done in terms of your grades from college. They'll take a look at your MCAT scores. They will also take a look at your activities, what you did in college in terms of research, work, shadowing. They would take a look at your leadership experiences, your extracurricular activities in college. And because what we want to see is that you are a well-rounded person who is not just smart. To make a good physician, you not only need to be intelligent and have a strength in sciences and math, but you also need to be a great communicator. You need to be a compassionate person. You need to be a good leader. And so when you're applying to medical school, the committees will take all of that into account. They take a look at your entire college transcript, your grades, your scores, what you've done while you were in college. And so when you're being admitted to a medical school or you're applying to medical school, your entire application will be reviewed and you may be granted interviews. Now, this is a great lesson in rejection because most people who apply to medical schools, get a handful. You'll apply to 20 medical schools and maybe only get 1 or 2 interviews and maybe only get into 1 or 2. And so, it's a great lesson in rejection. Some people don't get in the first year round, the first time they apply, and then they can go and do some research or work or shadow for a year and then reapply the next year. Just because you don't get in the first time doesn't mean that we don't need you or that you won't become a doctor one day. People say that getting into medical school is the hardest part, and I agree and disagree. I agree in one hand because you have to make sure that in college, your application is pristine, that you get the best grades you possibly can get, that you write really great essay, you get the best MCAT scores, and that you are participating in activities that contribute to you that they're going to make you a better candidate, a better applicant for medical school. So I agree that that's really difficult because you're in college and you want to have fun and you want to do all the fun college things. Sometimes balancing that with getting good grades and performing well academically and extracurricularly is a difficult balance to achieve. The reason that I disagree with that is because the first 2 years of medical school are really hard. Probably the most difficult experience of my life was the first year of medical school. And the reason that I say that is because there's nothing that will ever prepare you in high school or college for the rigor that you will experience academically in the first year of medical school. I realized so much about myself in the first year of med school. I realized I didn't really truly know how to study. The course load, the amount that you need to know, the number of tests that you need to take, and the detail and the specificity of the content is just really overwhelming, because in the first 2 years of medical school, you basically learn the basic human sciences. So like anatomy, physiology, histology, you learn all of that in the first year. Those are kind of the basic sciences that introduce you to clinical medicine. It's the foundation. The second year of medical school is equally difficult, but it's a little bit more interesting because you start to learn about the body system. So it's in your second year of medical school that you'll start to learn about pathophysiology. So you learned about the heart, but now you'll learn about cardiac conditions. So you'll learn cardiology, you'll learn gastroenterology, you'll learn pulmonary medicine. You'll also start to dive into some of the other fields of medicine like pediatrics and issues relevant to taking care of children. You'll have courses in OBGYN and surgery and psychiatry. So it's in the second year that you really start to utilize the foundational knowledge that you learn in the first year and start to apply it to the human body in the second year. The first 2 years tend to be classroom-based, lecture-based. My school was the New York College of Osteopathic Medicine. It's now called NYITCOM, and it's an osteopathic school, which I adored. I really, truly valued and loved my time at NYCOM. And the first 2 years were clinical medicine. We worked with a mentor, we worked with academic support teams. We had a lot of resources on campus that allowed us to maintain a healthy balance in our lives when your life is so consumed with classwork, you're sitting a lot. And so there are a lot of initiatives to help us remain healthy, physically active, mentally and emotionally healthy while we were going through this very, very difficult time, which is the first 2 years. Then you get to the good part, which is the rotations. And everyone says third and fourth year of medical school is like the best time. And I couldn't agree more, because you are there strictly to learn. You are basically doing on-the-job training. So third and fourth year of medical school are your clinical rotations. Third year is when you go through your core rotations, meaning we did 6 core rotations. We did internal medicine, which is typically adult medicine, hospital-based, so patients who are hospitalized for different medical conditions. We did general surgery, which is obviously surgical procedures. We got to spend time in the OR. We got to do general surgeries like gallbladders, colon surgery. We got to see some orthopedics, which is bone surgeries. We got to see some neurosurgery, which is brain, which is an incredible experience. So general surgery allows you exposure to the surgical field and subspecialties. Then we do a core rotation in pediatrics, which is usually outpatient based, but does have some hospital work associated with it. And pediatrics is taking care of children, typically from birth to age 18 or so. We also do core rotations in OBGYN, which is both hospital and office based. Obstetricians deliver babies in hospitals, but they also are gynecologists. So they take care of women's health, all things related to women's health, including breast disease, pelvic surgeries. And so in addition to OBGYN being a very, generally very exciting field because you get to care for pregnant women, it's also a very highly skilled and technical field because you're also a surgeon and you get to go into the operating room and do a lot of procedures. The other fields that we rotate in during third year would be psychiatry. So you can go to inpatient psych wards and outpatient psychiatric offices to learn about caring for mental health conditions. And then family medicine, which is what I decided to do ultimately. Family medicine is the primary care of the entire family from birth to death. We take care of all ages and is generally an outpatient practice. So we see patients typically in the office. We focus a lot on prevention, vaccines, healthcare screenings like mammograms and colonoscopies. So those are the main core rotations that you take during your third year of medical school. And then fourth year is kind of really special because it's in the beginning of your fourth year that you apply for residency. And residency is the additional training beyond medical school where you go into one of those specialties. So you can choose, among others, you can choose internal medicine, family medicine, general surgery, pediatrics, obstetrician, gynecology, and psychiatry. Those are kind of the main fields. There are others. You can go into neurology, you can go into plastic surgery or urology. There's different types of residencies that lie outside of those 6 core fields, but generally you'll apply to one of those. You can also apply to emergency medicine, which is a common residency, anesthesiology, which is the study of utilizing anesthesia for pain relief and amnesia during surgeries, surgical procedures. But they also do interventions with pain control and spinal procedures. Those are the doctors who give you your epidural during delivery if you're going through labor. So there are some other specialties that you can go into. Physical medicine and rehabilitation is another one. It's the study of non-surgical rehabilitation of injuries and improving quality of life in patients who have some kind of physical difficulty. So there's a lot of different specialties you can choose for residency, but fourth year of medical school is when you really, between third and fourth years, when you have to decide what you want to do, which specialty you want to pursue. And then the summer of your fourth year is when you apply to those residency programs. So fourth year is really important strategically. So if you want to be an OBGYN, towards the end of your third year and in the summer, in the beginning of your fourth year, you'll want to do what we call showcase electives, where you go to the programs where you want to do your residency and you rotate with them so that they get to know you, so they can know who you are and see your work ethic and see if you would be a good match for their residency program. So in the beginning of the fourth year, you start to collect your application for your residency program, which means you're taking your entire medical school transcript at this point. All of your grades and your performance on your rotations leading up to that point will culminate in an application to a residency program. And for that, we use what's called the match system. So it's not a lottery, it's really an application process where you apply to programs in your particular field. So for example, you apply to family medicine programs, you will get your application for family medicine and you will rank your programs. So you'll interview at whatever programs offer you an interview. And then you submit a rank list, which means you say, my number one choice is Long Beach Medical Center, which is where I went to my residency. My number two choice is Nassau University Medical Center. Number three, and you go down the list of the programs that you interviewed and you rank them. The programs, on the other hand, go and look at all their applicants and they rank their applicants. They say, well, Dr. Lex was my first choice for application. And, Dr. Jones was my second and Dr. Smith was my third. And so the process, the match process, is it's a computerized process that attempts to match the choices of the applicants and the choices of the programs. So if Long Beach was my first choice and I was Long Beach's first choice, then we get matched. And that's where I go for residency. So somewhere towards like March of your fourth year, you have what's called match day, which is where everyone is notified that they matched with a program, meaning you were accepted into a residency program. You were matched with a residency program in the field of choice. And what's interesting about this is that you're not really competing against everyone like you are to get into med school. You're just competing against all the other people who applied for family medicine. You're not going to be matched against anesthesia applicants, or you're not going to get matched against pediatrics applicants if you are a family medicine applicant. You'll only be matched against people who or only be in competition with people who are also applying for family medicine. And so the pool is smaller for sure. It's larger for the more popular specialties, but nonetheless, your pool of applicants is smaller. Now, if you didn't match, there's a couple of different things you can do. You can take a year to do research. You can take a gap year where you can work. Some people will do other things to bolster their application and then re-enter the match again the following year. Some people will decide at that point to change specialties or pursue something different. And so, once you match March of your fourth year of medical school, at that point, you know where you're going to be going for residency. Typically, you graduate in May, and the residency school year or residency academic year, because it's still academic, you're still learning, you're always learning, but the academic year for residency programs usually starts on July 1st. And so most people after medical school have 6 weeks or a month or so without any obligations, probably for the first time in a long time, where they don't have to study or they can just kind of relax and prepare to go into residency training. Residency training is a lot of fun. It's a lot of hard work. That's when you are, learning the most about now your particular specialty. So you learn the basic sciences, you learn how to apply them to the human body. You did all the core rotations. You did all of your elective rotations in the field that you want to be in. Now you've matched into your field, you show up to work and you learn to be a family doctor, or you learn to be a pediatrician or an obstetrician gynecologist. Usually that first year of residency training is more of a general year. Some folks call it internship year. Some people will call it a transitional year, which means you're transitioning from medical school into your specialty. And so internship year, for example, for OBGYNs might be more geared towards all the general things that OBGYNs need to know and utilize in practice. So they might have more rotations that are heavy on family medicine because psychiatry is important and mental health is important to OBGYN. They might do some rotations in psychiatry, but typically your first year is a very broad education, broad academic education. And again, as a resident, you will do rotations. So you'll go through different, spend 6 weeks in, if you're doing a family medicine residency, for example, your first year is, again, just working on the wards of the different specialties. So you'll do pediatrics, family medicine, you'll do OBGYN, surgery, psychiatry, and so you get exposure to all of that. One of the common things for residency training, for continuity and for you to, as a resident, develop a panel of patients that you follow and take care of, is you usually have a continuity of care clinic, which means that you will start to get a panel of patients as early as your first year of residency. And then you'll go to that clinic where you can see those patients. Let's say, for example, it's Friday morning. You go every Friday morning, regardless of what your other workload is, and you go to that continuity clinic and you take care of the same patients over and over throughout the course of your residency. And by the end, you're their doctor and they're sad to see you go when you graduate, but you've developed a rapport and a relationship, and you have followed those patients for the length of your residency program. Some of them you might just see come and go. If people come in for a particular issue like an infection, you might see them once. Some programs have like walk-in hours for patients who need urgent or emergent things. And so depending on what specialty you're in, what program you're in, your continuity clinic may look different. But most residency programs have some kind of continuity for you to develop panel patients. Now, when you're a resident, everything that you do is under supervision. So you are, every decision that you make should be discussed or approved by either the residents who are more experienced than you, so your senior residents, your fellows who are in the next stage of training, or your attendings who are the fully licensed physicians who are in charge and have the ability to make decisions independently. So once you get to that status as an attending, you're pretty much free to practice on your own without any supervision. But as a resident, you need a lot of supervision because you're just learning, and a lot of mistakes can be made. Mistakes can be made at any stage, but especially as a resident, you're starting to incorporate everything that you've learned from medical school and in your clinical rotations and apply that to real patients. And so it requires a lot of supervision. The reason that training is so long is because you learn by repetition, you learn by doing. And if you see enough patients, you'll encounter enough pathology and enough of the same cases to know by the time you're in attending and practicing independently, when you see a person who comes in with kidney failure, you will have seen it a million times in residency, and you'll have taken care of that patient with kidney failure under the supervision of your the physicians who have trained ahead of you. And so the goal is to get a sufficient amount of exposure during your training program so that when you graduate, you're prepared to go on and take care of patients on your own. For example, a surgical resident is going to go through 5 years of general surgery training. And in those 5 years, they're going to do a certain number of gallbladder removals. They're going to do a certain number of colon resections, colon surgeries. They're going to do get experience in all kinds of other surgical subspecialties so that by the time they graduate 5 years later, they can go and practice independently. They can go and run an operating room and do the procedures that they're credentialed for on their own. So it's important to understand that as a resident, you're constantly under supervision. And as you ascend in residency, you have more independence and more freedom. So a senior resident, somebody who's in their last year of training, has much more independence and decision-making abilities and privileges than a first-year resident or intern. So you go through your training, you do all of your rotations. As you get towards the end of your residency, you start to do electives again. So say, for example, you are an OBGYN resident and you decide that you want to go into infertility. You want to do reproductive endocrinology, which is an infertility specialist. You might do some electives in that, working with some of the teaching attendings who specialize in infertility treatment. Or you might decide that you want to be a urogynecologist dealing with issues related to female urinary tract. So you might do some electives there. If you are a general surgeon and you decide you want to do fellowship towards the end of your general surgery residency, you want to do some electives in the subspecialty that you want to pursue. So for example, if you want to pursue hand surgery, which is a subspecialty, you might do some rotations in hand surgery. If you want to be a trauma surgeon, you can do some rotations in trauma surgery so that when you get out into your fellowship, you have some experience and knowledge there. So like I said, residency can last anywhere from 2 years. I believe preventive medicine fellowship is 2 years. And I think neurosurgery is probably the longest, somewhere around 8 or 9 years of training. I don't know exactly. So they can be very, very long. You know, a neurosurgeon obviously needs that many, 8 or 9 years of training under a supervising attending before they can go out and perform brain and spine surgery. Family medicine for me was a 3-year residency. So after 3 years of training, I was able to go out and take care of patients in a family medicine clinic or in the hospital independently. If your residency ends, you can then take your boards and you can go out, become board certified, and you can get a job and practice independently. Or you can decide to continue your education in a specialty, and that's called fellowship. So depending on which specialty, which field you choose, there are different fellowships that are available to you. So as a family physician, for example, the fellowship options that are available after family medicine residency are sports medicine, geriatrics, which is the care of elderly patients. You can do a women's health fellowship. You can do hospital medicine fellowship. You can do palliative care. There's several specialties that you can pursue after family medicine residency. After internal medicine residency or pediatrics, you can pursue subspecialty, which means you can specialize in an organ system. So like for internal medicine, you can specialize in adult pulmonary medicine, so lung medicine. You can specialize in cardiology, gastroenterology. You can specialize in kidneys. It's called nephrology. And so as an adult, you can become a subspecialist in one of the organ systems, or as a pediatrician, you can then go and subspecialize in pediatric kidney disease or pediatric lung disease. Similarly with general surgery, you can then go and pursue any number of fellowships: plastic surgery, trauma, colorectal surgery, hand surgery. There's a number of different fellowships that are available to general surgeons after they finish their residency. Psychiatrists can pursue different fellowships after residency. Like you can specialize in child and adolescent psychiatry. You can specialize in geriatric psychiatry. There's a number of different fields for psychiatrists. OBGYN, the specialties are urogynecology, so urology for gynecologists. You can specialize in gynecologic oncology, which is cancer in women. You can specialize in reproductive endocrinology and infertility, and you can specialize in maternal fetal medicine, which is high-risk pregnancies. So once you finish your residency, there's a number of fellowships that are available to you to continue your training. By the way, you're like between 28 and 35 at this point. If you came right out of college and went right to medical school, you know, your friends have all been working for 10 years and you're just getting started in your ability to earn a salary. By the way, that's a common question. When you're in residency, you do get paid. It's a pretty standard amount across the board. You do get paid to work because essentially you're working for the hospital and the program that you're training in. And in exchange, they pay you a salary as well as provide you training. Once you complete your residency, if you decide you don't want to do a fellowship, you then become an attending and you can go out and apply for jobs and practice medicine, take care of patients. Or you can then pursue a fellowship where you can go into subspecialty training. And that can vary depending on the subspecialty that you choose. The number of years will vary. Obviously, the more specialized you get, the more training you need, the longer the program. And so, and then there are subspecialties. For example, I failed to mention radiology. Radiology is a very popular field in medicine that you can go into as a residency program. And then after that, you can do fellowships in radiology, subspecialties. You can do breast radiology, you can do musculoskeletal, you can do fellowships in ultrasound, or interventional radiology is very popular. That's where radiologists do procedures, like they'll drain fluid and do biopsies on patients, or they'll take breast biopsies. They'll put in ports and lines and drains. That's a very cool and interesting specialty, because people typically think of radiologists as looking at images, and that's primarily what their training is. But then to have a hands-on component as a radiologist is a very exciting way to add additional skills to what a radiologist is capable of. So if you decide not to pursue fellowship and you decide you want to go out into the world, you practice medicine, you typically start in your first year where you're employed, or other option would be to start your own practice, which is scary and requires definitely some business acumen that they do not teach you in medical school. There's a lot about practicing in the world of medicine that I wish was more emphasized, and that if I can recommend, you start to study the medical legal aspect of medicine, meaning the liability that's associated with how you practice medicine. The business of medicine is not something that's part of a curriculum in residency training programs, or if it is, it's a very small part of the curriculum. So understanding the economics and how healthcare systems work is very valuable information and can be pursued in addition to your training. You can pursue that on your own, or some programs, like some residency programs, will be combined, meaning you'll get medical school. You'll get your MD and MPH, which is a master's in public health. So then you can utilize that training to maybe work in a public health field like epidemiology or health information systems. You can also do combined programs or separate programs where you get your medical degree and an MBA, a Master's of Business Administration, which then gives you the potential to enter into business, like the business of medicine, like hospital administration, insurance, pharmaceuticals, any kind of non-clinical parts of medicine that are non-clinical, like the leadership. But it's very important at that point to have some kind of training or understanding of how hospital systems work, how medical care is delivered, and the economics and politics and of the entire healthcare system. And so, our parents' generation, my parents' generation was one where there was a point A and a point B, and you went from, saying, I want to be a doctor, to going through the whole process. You become a doctor, and then you practice medicine for the rest of your life. And that's your contribution to society. You're happy with your life and your career, and that's it. Nowadays, there are a ton of ways that physicians can contribute to fields other than medicine. There are many alternative careers for physicians, meaning that you can utilize the skills that you learned in medical school and apply them to other fields like engineering or consulting. You can consult for businesses or enter into the economic or political aspects of healthcare. So you can utilize your education and training to impact other industries. Or you can utilize your medical training to create something new, to create a business, a healthcare model that's new or different, a healthcare product that's new, healthcare technology. I know specialists who've created ways to deliver care online, to deliver contacts for patients who need contacts online, or who can prescribe birth control online. So there's millions of ways to be innovative and utilize the skills, education, and experience that you have as a physician to impact other industries. There are also alternative careers for physicians, like, for example, you can go into research, you can go into pharmaceuticals, you can go into biomedical engineering, you can go into education, you can become a teacher, one of the administrators who delivers medical education to either medical students or residents and fellows. You can become a medical writer, you can write, you can become a speaker or lecturer, you can dive into other specialties. You can go back and do a second residency or train in something different if you want to. You can start your own thing, you can start your own business, your practice. Telemedicine has exploded in the past couple of years and has really become a useful way for doctors to utilize some more of their skills and take advantage of the technology that we have to increase access to healthcare. There's a lot of different ways that you can not just go through the process and become a doctor and go to work in an office Monday to Friday, 9 to 5, and see patients. While we need doctors who are there to deliver care to our patients, we also need doctors who are in every corner of our society, in every field, in education, research, commerce, politics, business, finance. So we need doctors everywhere. And so there's a lot of different options for physicians, whereas in the past, it was probably a claim to fame that, went to med school, became a doctor, and took care of patients. And some people will do that, and that's perfectly fine too. Some people will be happy with a career taking care of patients and delivering medical care to patients in our communities. I think that's all that I have to say about going through the process and what it entails and what it's like. If you have any specific questions, I'm always happy to answer, discuss, and educate. So please let me know if you have any questions specifically about the process of becoming a doctor, some of the decisions that we have to make, some of the sacrifices or hardships that we have to face during our education and training, or about some of the alternative careers and things that are possible after you graduate from residency and fellowship training. I've done a lot of them. I've done, consulting, utilization management. I've been an expert witness for malpractice defense lawyers. I was in medical education. I have my own private practice. I work in telemedicine as a hospitalist. and I've done some palliative care and some medical writing. And many of us, there's a ton of doctors who are out on social media, not only educating about health-related topics, but also educating about the world of medicine, the politics, the financial aspects, the economics, the trends, as well as more information out there about how to become a doctor, how to get involved in a career in medicine. So if you like what you've heard and you want to talk more about it, please reach out, go follow some physicians on YouTube, on Instagram, and Facebook. There's a ton of us out there. I can put some recommendations for some fun accounts to follow and learn from in the notes below. I hope you've enjoyed this as much as I have. I love talking about my journey and talking about what it takes. I'll just close by saying that no matter where you come from, who you are, or what you are doing right now, if you want to have a career in medicine, 100% you can do it, and it will be worth it. Don't let anybody else tell you anything otherwise. Thanks so much for listening.